Generalized anxiety disorder, otherwise known as GAD, can be defined as excessive, uncontrollable, and persistent worry about everyday things. Most people have felt nervous before a test, and usually after you've taken it, the nervousness goes away. However, for someone with GAD, that nervousness can linger for up to 6 months. Their nervousness is never switched off, and it's always on. Someone with GAD has often described it as a giant noisy alarm clock banging around their head. GAD typically begins to show up in patients at around 13 years old, and these symptoms aren't just in their head, they're actually very physical too. Physical symptoms include restlessness, fatigue and tiredness, and also irritability. In fact, it's often described online as if your body is constantly bracing for a punch that never comes. Those who have GAD should know that they're never alone. Approximately 3% of the United States has GAD diagnosed, and it's especially prevalent in teens. According to studies, 1 in every 17 has GAD diagnosed. Also, it is twice as common for females to be diagnosed compared to males. So why? What causes GAD and why is it especially prevalent in the youth? The truth is there are 2 main factors, nature and nurture, biological, genetic, and environmental influences. Biologically, the brain's fear center, the amygdala, is hyperactive. Also, if your parents have GAD, you're more likely to experience it yourself as well. In an environmental sense, school, social media, status, relationships, and the conditions at home can all contribute to if you have or will experience GAD. So, what can we do? The good news is GAD is treatable through cognitive behavioral therapy, or CBT for short. CBT is where a therapist will challenge one's thoughts and push for cognitive changes in the processing of the patient. For teens, oftentimes school counselors are a great first step towards therapy. One could always message home to 741-741 to reach the crisis text line in instance of emergency. Remember, anxiety is a passenger in your car, but it doesn't have to be the driver. Thank you so much for watching.